All righty, let's get started. All right, we are going to continue on with COVID-19, what we know so far and planning for the future. For those of you who haven't been on the webinar before, we always have new people as well as old people. So this presentation always a combination of new and old, so you don't miss anything if you haven't been on it before, and we add some new stuff every week. My name is Dr. Valda Crowder. People call me Dr. V. I'm an emergency medicine physician. I've been working for 30 years in emergency medicine. And we're doing this webinar so that everyone has in their community has someplace to go on Tuesdays and Thursdays at 8 o'clock to ask questions. As we go through this pandemic and go through the wintertime, there's going to be a lot of ups and downs. We've already experienced a lot of ups and downs. And I wanted to just really make sure that everyone had a reliable source, someplace they could go every Tuesday and Thursday during the week to get the real answers to some questions. I have a website, AskDrV.us, and on that website you will find a lot of the source materials for the things that are discussed here, so you can actually look at the original source materials yourself. All of the presentations that you see on our website or also on our YouTube will be dated because the information changes very rapidly. The structure is 10 to 15 minutes of a presentation followed by question and answer. And altogether it will be anywhere from 40 to 50 to 60 minutes long. We usually end at about 9. Sometimes we end earlier, it just depends. Everyone during the presentation is in listen mode. You can ask a question by turning on your chat icon and actually writing it in there or writing it into the Q&A. I take written questions first, and if there is enough time and if it's manageable, then I sometimes let people off of mute so that we can actually hear from them directly. But I take written questions first. The intention of the webinar is to keep participants informed with COVID-19 science that will help you and your family stay healthy during this pandemic. The outcome is you will leave the webinar motivated to create an action plan for you and your family, or you may be motivated to create or modify an action plan for a broader community, like a homeowners association or a union or a workplace or a church or a school or something like that. We had started off talking about pandemics and how they impact world leaders. And this was a slide that I showed at the very beginning back in February that just showed sovereigns that were killed by smallpox. So we are now dealing with world leaders who have also been impacted by COVID-19, right? And this is just sort of a brief list. This is not all encompassing, but it kind of gives you some idea. I tell people all the time, respect COVID-19 because it is highly contagious. It only requires 45 seconds of contact to actually become infected. And if 100 people are exposed to COVID-19, 60 to 80% of them will actually become positive, as opposed to the flu, which only maybe 30% or so will come back positive, just as a rough estimate. It operates as both a droplet and an airborne disease. Whether or not something is droplet or airborne is based upon the size of the particle. So a droplet is 5 microns or greater. That's why it falls within 3 feet. Airborne is less than 5 microns and can land further than 6 feet, actually. An example of droplets are Ebola, pertussis, mumps, and airborne, you're thinking more tuberculosis or measles. So this just shows in the red what a droplet would look like. And then in the gray, it actually shows what an airborne particle would actually look like. So as you can see, it would infect all of the things or affect all of the things that are in the area. So it could drop on people's shoes, people's clothes, there could be people, there could be things all within this pathway. Okay, this is why a mask is so important. We recently today, I don't know if any of there are soccer fans out there, but one of the biggest soccer fans, Cristiano Ronaldo, tested positive for COVID-19. So let's talk about how do you know if you actually have COVID-19 or not. So the diagnosis is made by PCR test, antigen test, or CAT scan findings. So the PCR test is actually the more reliable test. It's most accurate 8 days after exposure. If you take it too soon or take it too late, after 10 days, it will be negative, even though you may still be infectious, right? So recently, our president took a PCR test 10 days after exposure, which you would expect to be negative, versus a antigen test, which actually will stay positive longer, but it will sometimes give you a result where it'll tell you that the person does not have COVID when they do. So it misses COVID about 20 to 30% of the time. And this is what we're talking about when we say we have problems with our testing, right? Both tests have significant drawbacks. So what we do in medicine is to determine if somebody's really negative, they have to have 2 rapid tests that are negative 24 hours apart from each other. And that's what we do to actually determine that they're negative. Now, there's some people that stay negative, their tests stay negative, but we're still seeing symptomatic signs of it. And for that, we do a CAT scan, and the CAT scan actually has a very distinct appearance with COVID-19, and those small yellow arrows there in the middle on the bottom row sort of show the ground glass opacities that you actually see, and you usually see them on both sides of the lung. Now, there's different symptoms clusters. I think what's important is that COVID-19 is not just a respiratory disease. So to classify it as only a respiratory disease is actually inaccurate. It's a multi-system disease. So it can present with flu-like symptoms and no fever. It can present with flu-like symptoms and a fever. It can also present with only nausea, vomiting, and diarrhea, right? So somebody could think maybe they ate something that they shouldn't have eaten, or something was maybe stale. Those 3 clusters usually do pretty well, and they're usually self-limited, and they usually are not hospitalized. The clusters that are normally hospitalized or require some sort of oxygen treatment or medical treatment are clusters 4, 5, and 6. So 4 is ones with fatigue, 5 is the cluster with confusion, and 6 is the one where they actually have abdominal symptoms, respiratory symptoms, confusion, and fatigue. Now, let's talk about the COVID treatment plan. So one is you use a pulse ox to determine the level of oxygenation. If the pulse ox is less than 95%, that suggests that you should actually go in and actually be evaluated in the emergency department. And you may be oxygen requiring. The reason why you need to use a pulse ox in COVID, and you don't have to use it in other diseases, is if you have pneumonia, regular pneumonia, if you're short of breath, you know you're short of breath. With COVID, people don't necessarily feel short of breath, so that's how come we have them actually use it at home. Vitamin D, zinc, famotidine, which we'll talk about, dexamethasone, which is Decadron, that's the steroid that you hear people talking about, remdesivir, which is a antiviral medication, and then the experimental medication that you've heard people talk about, which is Regeneron. And Regeneron is actually not the name of the medication. It's actually the name of the company that produces the medication. But when they're in the experimental protocol, they don't actually have a name yet. So famotidine. Famotidine is basically just Pepcid AC. Everybody has seen this in the drugstore. Pepcid AC can come in tablets by mouth, and we have higher doses obviously in the hospital, and we can also it can also be given IV. So it's been associated with lower hospital deaths and a better combined outcome when you look at death and intubation, and basically it blocks histamine release. Dexamethasone is a steroid. A lot of what happens with COVID-19 is not necessarily the infection, but it is the inflammatory response that occurs as a result of the infection. And that is actually what causes a lot of the problems. So steroid use has been found to lower the 28-day death rate for people requiring oxygen and ventilation. We primarily give it to people requiring oxygen and requiring ventilation. Remdesivir is an antiviral medication. It was originally developed to treat hepatitis C and RSV. Remdesivir, interestingly, was a medication that was developed as a result of stem cell research using fetal tissue. That medication actually blocks the replication of viruses. So when a virus enters a cell, it releases its genetic code inside of the cell. So this picture actually shows the red with the prongs on it is the coronavirus. And the coronavirus attaches to the little receptor there that's an upside down cup, or looks like a cup. And you see it entering into the cell. Then what happens is it takes this genetic code and it begins to convert it to proteins. And then the proteins make copies after copies after copies after copies after copies. And that's how it sort of replicates inside of your body. And then it can get assembled into a new virus and move on. So remdesivir actually, the infection gets into your cell, but it actually blocks the replication of the proteins. Regeneron, again, which is the name of the company, but not the medication, Regeneron actually has an antibody cocktail. So there's two antibodies directed at key proteins on the surface of the virus. So this is not something that we actually give currently. If you're a part of the experimental protocol, then you will get this or a placebo. In President Trump's case, they actually applied to the FDA for emergency use and for compassionate care, emergency compassionate care use, which then made sure that he would actually get the medication. This medication also is a result of stem cell research from fetal tissue. And basically what it did was they created from this stem cell research, they were able to inject a mouse and create a mouse so that it has a human-like immune system. And then that human-like immune system, they then give the mouse COVID, and then that human-like immune system inside of the mouse actually produces human-like antibodies. So they mix that with regular human antibodies. And that's how they actually came up with the antibody cocktail. You've seen some talk about serum markers. Serum markers are the things that the blood test and how they come back. So serum markers, your white blood cell count, because it's an infection, would be high. Your lymphocyte count is low. C-reactive protein is just just tells you how much inflammation do you have in your body. So that would be high. Procalcitonin level is high. And D-dimer, which is very, very important, that also is high in